Good morning, everybody. Hope you're having a great day so far. It's early here this morning, but I had some time to get online and talk with you. I have some interesting, wonderful new information that I've just learned, and you know me, I'm always learning something and wanting to perfect it in the best way I can and share it with you. I had the most wonderful pleasure of attending the International College of Applied Kinesiology's conference last weekend. It was in Arlington, it just so happened. Excuse me, and it was 20 hours or more of terrific presentations by different physicians. So, for example, medical doctors, doctors of dentistry, doctors of oriental medicine, osteopaths, all kinds of doctoral level people who are presenting papers. And there was a wide range of topics, really. Everything from treating the most elite athletes in the world to dealing with digestive issues, scoliosis, emotional trauma, and more. And I had such fun sitting there and listening to all that my colleagues here and also from 15 other countries had to present. And when I go to conferences in general, I always find I try to find one thing that I really can focus on and that I'm attracted to, that I want to learn more about, and that I'd like to serve my patients with more. And it was very hard to choose. I'm going to be straight with you. It was hard to choose because there were so many wonderful people and ideas present at this conference. It was very hard to choose. So I can't tell you that I actually narrowed it down to one thing, but I'm going to start with one thing. And I had the pleasure of meeting Dr. and Mrs. Michael and Cynthia Lebowitz there, and they are working hard and have been working hard for decades on protocols that relate to the resolution of something called dysbiosis. So what is this? Dysbiosis really is a condition where in our guts there is an imbalance of the healthy flora, bugs, versus unhealthy or opportunistic ones. And you might think at first, well, okay, so if you have dysbiosis, you have an upset tummy, so to speak, and that's definitely possible, for sure. But dysbiosis actually goes way beyond that, because the health of the gut really affects everything else. We know that much of our immune system is wrapped, the lymphoid tissue is wrapped around our guts. So what is going on in the intestinal system affects not only how we feel digestively, but also it will control or not control the level of inflammation in the body. And inflammation is key because it can affect the brain, the immune system, the joints, and everything else. Dr. Lebowitz says in his manual and his protocol for the complex patient a whole bunch of symptoms and conditions that are related to dysbiosis, and I'm just going to read them to you. There's fatigue, poor memory, feeling spacey or foggy, hypoglycemia, which means low blood sugar, vaginal discharges and itching, in regard to mood, irritability, depression, food sensitivities, constipation, diarrhea, chronic misalignments of the spine that we call subluxations, hypothyroidism, hypoadrenia, meaning poor adrenal function, insomnia, headaches, sinusitis, abdominal pain, bloating, obesity or the inability to lose weight, prostatitis, premenstrual syndrome, chronic rashes and itching, rectal itching, and chemical sensitivities, to name but a few. And this is all good and well, and for years and years and years, chiropractors have been suggesting to people, and other people too, not just chiropractors, have been suggesting the use of probiotics to help heal the gut, right? Good idea, right? It is really a good idea, but it's not the only thing. In fact, I learned this past weekend that some probiotics actually can make dysbiosis worse if they contain certain bugs which feed our sensitivities to food, like Lactobacillus casei. If you have a problem with casein, not a good probiotic for you. There are many, many, many products on the market to deal with dysbiosis, and I tend to have always said that it is not wise to get supplements that have like a gazillion ingredients in them. You know, a lot of the vitamins today tend to include everything but the kitchen sink. And I don't think, generally speaking, it's a good idea, because you never know if there's something within a supplement like that to which you're reacting in a bad way. There might be good things in it too that would actually help your immune system, but if you are feeding yourself a source of inflammation, then, you know, it's kind of going down the tubes. So, what to do from all this? Another important thing beyond the probiotic for a moment is to actually do away with the unhealthy microbes that are living in the gut and are affecting the health in all those ways we just enumerated and many more. Because they promote a pro-inflammatory state in your body and cause all kinds of problems beyond this one, including autoimmune diseases like food allergies, sensitivities, autoimmune arthritides, and all kinds of stuff. So we also have to do away with the microbes that are creating the pro-inflammatory state. So using applied kinesiology techniques, which have been refined by Dr. Lebowitz and others over years, are a wonderful way to help gently deal with the dysbiosis, the biofilms in the gut, which is this like sticky mess that microbes hide in and make it difficult to kill, and so forth, to help restore the gut. The protocol uses functional muscle testing and the use of single remedy herbs to help find and weed out the dysbiosis. I'm very excited about this. In the past, I have not had really any sufficient education in herbs. I always tell my patients, you know, I'm not an herb person. Not because I don't believe in herbs, I do. They're very powerful medicine. I've just not been educated in them up until this point. So I always believe that the Almighty puts in our way what we're supposed to learn at the right time. So this must be my beginning to learning about herbs. So in any case, we use the functional muscle testing in this case to identify the pathogenic microbes that our body would rather not have present, and also to identify remedies that will help create balance in the gut and promote health and well-being. In addition to this, there are dietary changes that can help resolve dysbiosis as well. For example, if part of the reason that there is dysbiosis is because you have a fungal infection, then there are certain dietary things you have to do as well as killing the microbes. So, for example, staying away from fungus-producing foods or foods that are produced by using funguses. So that includes like soy sauce and vinegar and sugar and moldy cheeses and things of that nature. So it's never that we only use remedies to heal something, but also looking at our environment as well. What can we do in our dietary environment to create balance? In addition to the dietary environment, by the way, it's just your environment. So if you have issues like having a mold growth in your home, you know, like musty basements, you've had leaks, you've actually seen mold, that's another cue. And also, by the way, if you have a beloved partner or a spouse who has these health issues, the dysbiosis can be passed back and forth between the two of you because of intimate contact. So it's not only important to treat the patient who has a particular complaint, but also sometimes their partner too. So I really tend to like, in general, these protocols that involved not only finding the remedy, the muscle inhibition, fixing that, and letting the patient go with it, but also addressing their overall environment. You know, and today we have so many more toxic elements in our environment, whether it's the mold, the dust, the animal dander, and body fluids, the electromagnetic frequency radiation from our cell phones and our monitors and all this stuff. So when we can really get real about this stuff and start changing our environment and our food and all this stuff, we start to get healthier. So is dysbiosis easy to fix? Well, maybe in some people it is, but in some it's going to be a real challenge. So it's something a patient can expect to, keep pursuing over weeks, if not months, depending on the severity. Certainly a person who has something like chronic Lyme disease is going to take a lot longer to heal than somebody who maybe has, a simple bowel dysfunction because of a short course of antibiotics. There are differences among people. So anyway, having recently learned this new work, I'm very, very excited to start working with it. At the same time, I think, as you also know of me, is that I'm cautious. And that is, I want to start slowly and introducing the idea to a few people at a time, so I know that we can manage it and we leave the patient feeling well and supported properly and so forth. So given this information, I am looking for a group of perhaps 5 patients, 5 people to start working on with this work. And the qualifications are that you can be a new patient to our office, but you have to be a patient in my office. And you have to be willing to work with me as I become very meticulous and specific about looking up remedies and treating you in a holistic manner. Ideally, it would be appreciated if you'd be open to doing some lab work to assess your overall health and also looking for specific sources of inflammation. So if you think you are this kind of person and you would like to work with me, both to help you and also to assist me in my learning, I'd like to hear from you. Please don't leave this comment on the Facebook page right out. We don't want to share your deepest health concerns with 50 million of our best friends. So please send me a private message and we can talk in a private way. So this is what I've been learning, and I see I have a couple of folks here watching me. I hope I've done a good job of explaining what I've been learning about recently. As you know of me, it's really my profoundest joy to learn and to expand my ability to serve. And as always, I hope you'll ask me good questions, and I hope I can give good answers. And if I can't, I know really smart people who can help me find them. So I'd like to give a shout out to Mrs. Lebowitz, who just joined us, and also to Danielle, who's saying hi. Are there any, and also to Beth, who just joined me as well. Are there any questions before I sign off today and get started with my day? Again, if you'd like to join me in looking at this concept of dysbiosis in you, please let me know, or let Letitia at my office know. Our phone number is 703-383-1630, and we'll be happy to help you. Or if you just want to start a conversation with me about this, that's cool too, because the more we converse, the more I learn. All right, well, thank you for joining me, everybody, and I hope you have a wonderful day, and thank God it's getting cooler in Northern Virginia. Woohoo! And take care. Have a great one. Bye-bye now.